Hi, I'm Dr. Alexis Hazen, and I want to talk to you about compression garments following top surgery and whether it's important, not important, useful or not useful. So many surgeons and patients alike think that compression garments are absolutely necessary following top surgery. We recently just did a literature review to look and see if there is any evidence that supports that or doesn't support that idea. And it turns out there's not a lot of evidence that supports the idea of using post-op compression binders in the setting of top surgery when the patient also has drains. So I think in cases where the surgery is performed without drains or even without incisions, so sometimes patients who are very small can undergo top surgery with simple liposuction. And in those cases, it seems that compression garments like a compression vest or ACE wrapping or a Velcro binder can be really useful to reduce the swelling in the immediate post-op period. However, in most top surgery patients, a drain is placed, and the drain is called a suction drain. And what it is a plastic tube that goes inside the chest, underneath the skin, and the tube comes out the body. And then there is a bulb that, when squeezed, literally creates compression. And when that bulb is squeezed down, you can see that the chest will be flattened and compressed to the body. So in the cases where the patient has a compression drain, binders are not necessary. Some people like to use them, meaning some patients like the way they feel. They can be very comforting, especially when you are moving out and about, taking a walk, maybe going for a car ride. Sometimes the movement is stunted by the compression garment, so that feels good to a lot of people. But to many people, the garment is just a reminder of their past life and why they wanted to have surgery in the first place, that they no longer wanted to bind. And there's really no scientific evidence currently that supports the idea of wearing a binder. So in my patients, I do not require that they wear a binder. I give every patient a compression binder, which they can wear on the car ride home from the hospital. And then if they like wearing the binder, they're free to do so, but they're not required to. And that's why I moved away from binders. I try to do everything as scientifically as possible. There are some things we don't have a lot of evidence on, but for the things that we do, particularly if patients don't like wearing the binder, I'm not going to require it. Most people are surprised when they find this out, but I think it's really important that we make medical decisions based on evidence and not just our feelings about things. So that's why I don't require a binder.